Hello, this is our presentation on opioid usage and Narcan administration. I'm Brisa.
I'm Brooke.
And I'm Lainey.
All right, so I'm going to give you a quick overview of opioids. Opioids are usually a benzodiazepine, and they suppress the central nervous system, which can lead to respiratory depression, cardiac arrest, and induced coma. And what happens is over a while, once you start to use opioids, you build up a tolerance. So then you want to take more opioids, which can lead to overdose. Narcan is an opioid antagonist which competitively binds to opioid receptors. This will block the effects of respiratory depression, cardiac arrest, and induced coma. Narcan can be administered through the nose, IV, intramuscular, and subcutaneously. After Narcan is administered, it will act rapidly, but it only lasts a few minutes, or for short periods of time. So it's important to note that if your patient is on a high overdose, that you have the correct amount of Narcan available. This drug holds significant importance as it has helped reduce the related mortality rate of opioid overdoses.
And then some pros are comprehensive care planning, including both opioids and Narcan and care plans allows for a balanced approach to pain management and safety. Another pro is flexibility in care. Narcan is life-saving, so having Narcan on hand provides options for adjusting care as needed. Another one is safety net. Narcan offers a life-saving option in cases of accidental opioid overdose. And then another pro is reduce anxiety. Knowing that Narcan is available may alleviate fears about opioid use for both patients and their families. Some cons include potential misuse. There is a risk of opioid misuse, especially in patients with a history of substance abuse. Another con is ethical conflict. Administering Narcan may go against the patient's wishes if they have advanced directive, refusing life-prolonging interventions. And then the last con is family distress. Families may struggle with decisions about opioid use or Narcan administration, mistaking natural end-of-life signs for drug side effects.
Perfect. And then our group stance on Narcan is going to be that it should be administered in emergency opioid overdose situations, even when the client has an advance directive. This is going to be unless the directive clearly and specifically refuses resuscitative intervention for the overdose. So according to the American Nurses Association Code of Ethics, it's going to support this perspective. The provision 1 underscores the nurse's primary commitment to the patient, affirming the inherent dignity and worth of every individual. Also in provision 5, that's going to emphasize the nurse's role in promoting health and safety while preserving integrity and moral agency. Now, from the Nurse Practice Act standpoint, most states are going to permit that nurses provide emergency care. This includes the administration of Narcan in life-threatening situations, unless explicitly prohibited by a valid specific advance directive. Now, this legal framework aligns with the ethical and obligation to act in the patient's best interests during emergencies.
A recent study by Giordano examined the effectiveness of remote training programs and opioid overdose response among nursing students. This study found that such training significantly improved both knowledge and attitudes towards Narcan administration, highlighting the importance of preparedness in emergency situations. This evidence supports the stance that administering Narcan in emergencies is both ethically and professionally justified. These are our references.
Thank you.
Thank you. Okay.